Differential diagnosis, clinical symptoms according to yin and yang. A comprehensive exploration of clinical symptoms using the yin and yang framework for effective differential diagnosis. The concepts of yin and yang serve as foundational principles in Chinese medicine, guiding practitioners in differential diagnosis. Understanding the clinical symptoms associated with yin and yang allows for a more nuanced approach to identifying health imbalances and tailoring treatments accordingly. Yin embodies passive characteristics associated with coldness, moisture, and internal states. It signifies a state of rest and consolidation, vital for maintaining balance in the body. Yang embodies active qualities linked to heat, dryness, and external manifestations. It represents energy, movement, and vitality necessary for dynamic bodily functions. Understanding the interplay between yin and yang is crucial for diagnosing and treating ailments, as it allows practitioners to identify whether conditions are rooted in excess or deficiency of these forces. Cold symptoms are characterized by a feeling of coldness, with conditions worsening in cold environments and improving with warmth. Patients often present with a pale or bluish complexion, indicating deficiency of yang energy. Heat symptoms manifest as inflammation and sensation of heat, often exacerbated by exposure to heat and alleviated by cold. Patients may display a red complexion, suggesting excess of yang energy in the body. Passive versus active symptoms. Passive symptoms are characterized by hypoactivity, where organs may function below normal levels, leading to conditions like bradycardia. Individuals with passive symptoms often exhibit a dull or introverted demeanor, and their symptoms tend to worsen during periods of rest and improve with physical activity. Active symptoms, on the other hand, involve hyperactivity of the organs, such as tachycardia. Those presenting active symptoms are usually restless and extroverted, with symptoms exacerbating during physical activity and showing improvement during rest. Wet versus dry symptoms. Wet symptoms are characterized by the presence of excess fluid in the body, leading to edema and mucus production. These symptoms typically worsen in humid conditions as the body struggles to eliminate excess moisture, but show improvement in drier environments where fluid retention is less pronounced. Dry symptoms are associated with a deficiency in yin, presenting as dryness of the skin, hair, and mucous membranes. Individuals may also experience brittleness in nails, tendons, and bones. Such symptoms tend to worsen in dry weather due to the lack of moisture, but may improve during humid conditions, which provide relief and hydration to the tissues. Night versus day symptoms. Night symptoms typically manifest in the evening, intensifying during the night and often showing relief during the day. This pattern indicates a possible yin-dominant condition where the body's energy is more depleted at night, leading to increased discomfort and distress. Day symptoms usually begin in the morning, worsening by noon, and then gradually improving throughout the evening. This pattern may suggest a yang-dominant condition where the body's energy is higher during the day, leading to increased symptoms in the morning and alleviation as the day progresses. Descending versus ascending symptoms. Descending symptoms typically manifest in the lower body, such as the perineum or extremities, often associated with conditions like edema and joint pains. These symptoms may indicate a yin dominance where the energy is perceived to move downward and inward, reflecting a lack of yang or active energy. Ascending symptoms occur in the upper body, affecting areas like the head and neck, and can lead to conditions such as hot flushes, neck tension, and headaches. This pattern suggests a yang dominance where energy moves upward and outward, indicating hyperactivity or excessive yang energy in the body. Contracting versus dispersing symptoms. Contracting symptoms are characterized by a movement from the outside towards the inside of the body. This can manifest as joint pains and muscle tension, especially in response to cold weather. Patients may exhibit a contracted or hunched appearance, indicating the internalization of discomfort caused by external climatic factors. Dispersing symptoms, on the other hand, involve movement from the inside towards the outside. This is often seen in conditions where internal issues lead to external manifestations such as sweating or skin reactions like urticaria. This can also include symptoms like arching of the back, demonstrating a release of internal tensions. Nutrition versus protection symptoms. Nutrition symptoms reflect the state of the body's tissues, indicating deficiencies or excesses in yin. For instance, thin, fragile skin can indicate reduced lung yin, while thick and oily skin can suggest an increase in lung yin. These observations help in diagnosing the overall nutritional status of the patient. Protection symptoms relate to the immune system's ability to fend off infections and respond to environmental changes. Issues such as recurrent infections that worsen with climate fluctuations may indicate a deficiency in protective mechanisms, often linked to imbalance in yin and yang. Substance versus function symptoms. Substance symptoms reflect the physical characteristics and quantities of bodily materials, such as the thickness of hair and skin, body weight, and the volume of fluids like mucus and urine. For example, an increase in mucus might indicate a rise in lung yin, while thicker skin may suggest a stronger constitution. Function symptoms relate to the activity levels of organs and their abilities to perform necessary functions. For instance, frequent and urgent stools suggest hyperactive lower intestinal function, while reduced urination and edema indicate decreased kidney function, showcasing the balance of an organ activity and overall health. Case studies, yin-dominant conditions. Headaches that worsen at night typically suggest a yin-dominant condition characterized by excess of yin energy, leading to stagnation and discomfort during rest. Backaches that improve with rest and worsen with activity are often associated with yin dominance, indicating deficiency in yang and inability to support active movement. Decreased urination and feelings of fullness in the bladder often indicate a yin-dominant state, reflecting poor organ function and possible stagnation of fluids. Case studies, yang-dominant conditions. Stress and insufficient sleep can lead to a condition characterized by increased heart rate and restlessness, indicating yang dominance. Patients may experience joint pain that worsens during rest, particularly in conditions such as osteoarthritis. This pattern suggests a yin-dominant condition despite the active symptoms. Seasonal asthma with a dry cough and bronchospasm, worsening upon exposure to allergens, demonstrates yang dominance, particularly in response to external stimuli. Understanding the association of symptoms with yin and yang concepts is crucial for accurate clinical diagnosis. By recognizing how specific symptoms align with yin or yang characteristics, practitioners can better identify underlying conditions and tailor treatment approaches accordingly.